Good
And
morning, sir.
yes.
Sorry,
Uh,
I'm Dr. Prachi Dave. So I had
yeah.
a question your talk was very nice. So the only thing was that there are times when our children do things that they should not be doing. And like the previous generations, we don't believe in hitting them or, being very aggressive towards them. But how do we, correct their behaviors without being too aggressive?
Right, right. Uh, Dr. Saab, this is a very good question again because this has to do something with behavior modification and behavior modification skills of parents. Okay. Now we were just discussing one front, and that was family, parenting, household setup, violence, and all those things. Now there is another thing which has to do with the child in itself. A child can be hyperactive. A child can be a little stubborn. There can be behaviors which are leading to aggression and all. I will give you one golden line, which is like every behavior, whatever my child does, is a behavior of the child. It is not my child, first. Second, if it is the behavior that he manifests or shows, there is always some purpose to that behavior. For example, if a child is throwing tantrum not attending school, for example, if a child is throwing tantrum not sitting at a place and reading, there is always some function. Function means why this behavior happens. Usually, we as parents, what we do is we start reacting on that behavior just like that without thinking, why is the same thing happening again and again? There must be something. For example, the task is a little difficult. Second, he needs to escape from the task, doesn't want to do it because there is something else a reinforcer around. There is mobile, TV, gaming, or something like that. Third, he has learned this behavior, and in the previous past, I have reinforced this behavior again and again. So I think I need to change that behavior. I'll give a simple rule. It's called A, B, and C. A is called antecedent, B is called a behavior, and C is called a consequence. B is the behavior. Whenever you want to change, modify the behavior of your child, remember this A, B, C. B is like, for example, my child is lying down on the floor just because I'm asking him to come on the table and read, isn't it? So the behavior is he is lying on the floor, he is throwing things. A is antecedent. What exactly happened just before that behavior? He was watching TV or he was having his favorite snack. I just took it from him. That is the reason he is lying down. C is consequence. What am I doing to him now? When he is lying down, I am engaging in a verbal spat. That I do. If you don't get up, I will not give you. If you and he is like wah wah wah. So ABC of this kind of a behavior, for example, is faulty. Faulty is like consequences and antecedent based interventions that a mother has done when he was busy with his favorite thing. We have not done a gradual transition. We have done an abrupt stoppage, which results in anxiety, and the child is like, why? I should not be stopped from watching my thing. And third is the consequence. When the child is engaging in that particular behavior, it is being reinforced by the attention given by a parent. So, what do we do here? First thing is antecedent based interventions. A, that I will not be abruptly stopping it. I will be telling him from, for example, TV to a lighter reinforcer and to something else, and then distracting and giving him time. Then consequence based intervention is I will not be giving any attention to the child unless and until attention means not even looking at him, unless and until he gets up and sits on the chair, then we engage in a conversation. So behaviors always occur, happen for a reason. The only problem is that we at times are not able to understand what are those reasons. In addition to that, there are some children, for example, 4 to 5 children in a group of 40, who have different behavioral or developmental problems. That, for example, there is something which is called ADHD, attention deficit hyperactivity disorder. There is something which is called social communication disorder. There is something which is called learning disability, dyslexia, dysgraphia, and dyscalculia. Any parent who feels कि inter repeatedly after even doing interventions my child is not able to sit at a place needs to rule out some kind of a developmental, emotional, behavioral, or psychological disorder. Okay. And for specific behavioral patterns, we need to consult anybody who can help you professionally. I hope this is the answer for your question, ma'am.
That was very nice. Thank you so much, sir.
Thank you, Boxer. Thank you.